Welcome to Innovators, a series where we sit down with thought leaders across the healthcare space to discuss some of the industry's most pressing topics. Joining me today is Mario Espino, founder and chairman of Complete Care Management Services, and today we're going to talk about how their technology-driven approach to care management is improving outcomes, reducing hospital readmissions, and transforming how patients experience recovery after discharge. It's great having you here today, Mario.
Thank you, Justine. Well, let me start at the back. Actually, let's start at the front. Let's start with what is our mission? Our mission is to be able to age in place and have quality of life at the same time. I think that the two mostly people seem to think that they're opposing. You can't have quality of life, and if you do, then you're not going to age, or if you have quality of life, you're not going to be able to age in place, or vice versa. And the truth is that, if you can manage those diseases, and everybody, it's the buzzword today, besides artificial intelligence, which competes with chronic care diseases, you're going to find most of the people in the healthcare space trying to find a solution, not only to manage the small percentage of people that have multiple chronic care conditions that are probably 60 to 70% of the overall cost, but how we get that data back to the people that are younger that are potentially have, either earmarks or family genetics or so forth that can be in that, get that disease. So, we've unpacked a lot, ourselves, and we've learned a lot. We actually believe we're pioneers. I think we are. We were the first ones to get approved by First Coast to do an extensive work in the chronic care management space, which now is covered under care management. And if you go to cms.gov, you put in the search box care management, and there's a couple things that come out there. TCM, transitional care management, that's that management of that patient leaving the hospital, going to the home. And you talked, very, it's something that's very well studied from our end and from everybody else's end. Today we cover about 80% of all the hospitals in South Florida. And the reason is because we're able to bring that 20% that is the average based on, government studies of that, meaning 100 patients leaving the hospital, 20 returning. And if you take a look at the population that we're particularly taking care of, which are those which have access to care issues, if you look at that population alone, you're probably looking at more like 30, 40% of the people, and we brought that down to 4%. So our care starts there, in transitioning that patient from an acute care setting into their home. And then once you're in the home, we thought, Justine, that it would be a complicated issue to sort of find out how was it that we could be significant in the overall management of their disease. We found that it was, it wasn't hard. Today, multiple years later, we're doing more and more advanced things. But at the beginning, just by being in the home, we were able to see the things that were evident that were not going to work. That patient would never be able to manage their disease because they couldn't, because they had cognitive issues and they couldn't manage their medications. Their significant other couldn't do it neither. How could that work together? But you need to be in the home. These patients that travel to these doctors and see the doctors when they're very sick, the doctors themselves know that these patients are going to be returning soon because they understand that this type of disease, where they're at in life, is not going to work, So we're the solution to that piece.
So there's been a lot of great work that's been done at Complete Care Management Services. Tell me a little bit about what inspired you to take on the challenge of really improving care transition and that post-discharge outcome.
Wow, that's a great question, Justine. I guess 15 years in the CMMI space, so there's a couple of different CMSs. There's one for Indians, there's one for other people, the one that we know the most, and then there's one that's called Innovations, CMMI. And I spent the last 15 years in the innovation space. My job at the C-level suite was to find the inadequacies that could be corrected, and if we're corrected, we would create best practices. And then at the same time, I was also challenged with identifying higher costs that could be reduced. So, having enjoyed those 15 years and seeing the dynamic information that comes to you and the way it comes to you, and having certain elements of, qualifications that were in place at that time for physicians, like PQRS, physician quality reporting systems, that you could go to and you could see where that particular provider was, helped me a lot about understanding and how we could be a real good facilitator in a demonstration project that came out, and that's how we started this business, which was called Primary Care First and Direct Contracting Entities.
So you recognize that hospital readmissions were a major gap in the care continuum. How did you use technology to build a more seamless, kind of patient-centered care model, and how are these tools coming together to ultimately improve care delivery?
Again, Justine, I feel like I'm just a messenger. These are problems that have been in existence for a long time. I think the patient leaving the hospital, unfortunately, the doctor never does the discharge conversation with the patient. Usually it's a nurse that comes in. Usually the documentation they receive is a 911 call or a call center that they can call into, but there's really no instructions there. So it really created a sort of a hole in the transition of that patient from the acute care space into their home, and we were able to, as soon as we got there, in our first couple of months, we were able to see that there was a lot of lack of information that was confusing those patients that were living alone, didn't have any recourse. The last place that they had received care from was the hospital, so they'd go right back there again. Sometimes they had multiple different medications for the same thing, the medication they gave them at the hospital plus the ones that they had at home. Really a big disconnect, and we hear about that disconnect over and over again in the healthcare space about no collaboration between the acute care facilities, and obviously that doesn't even get down to the providers like us in the field.
Well, and that's a great point. Innovation is not just about the tools. The teamwork is a huge part of that as well. So tell me a little bit about how you've built this culture of collaboration across your care teams that ultimately make this model work.
Okay, collaboration, sure. I call it DNA, and we when we find issues with and I would say just a year ago we found that there was an issue with the things that we saw in the home, and it wasn't just social determinants. It's just something that we call home exam today. Today we look at pests and pets. So the pests like roaches and rats and so forth, and the pets like the dogs and the cats and the parrots and whatever else. We've gone into homes where there's 50 animals in a 500 square foot apartment. You tell me how that's positive. So we the innovation piece of this is to be in the home, really try to train your people to be observant, be advocates. We go as far in the home as to get them onto access if they need, CHIP or something like SNAP, or if they need access to food or transportation. We do all of these things because if we don't do them, then their ability to be able to access care is limited, So, and then hence, here we are. We became the access point for care for these people that were at home.
And the outcomes of this model are remarkable, reducing hospital readmission rates from 20% to under 4%. What does success look like from both the patient and the provider perspective?
Well, I call it the 3 Ps, the patient, provider, and the physician. One, we're able to give them, the physician, more actionable information to be able to act on. 2, the payers win, and when I'm talking about payers, I think that the hospital as not as the payers of the claim, but as the ones that have to pay the claim, win too. And then, the one that's really should be in number 1, 2, and 3 spot, the patients. But, going back to specifically to readmissions within 30 days, the government has some penalties imposed on people, on hospitals that have readmissions in 30 days. So hypothetically speaking, you have a patient that leaves your hospital, readmits them within 30 days. You can't bill that patient for the hospital. And if they go to another system, then that system gets the money and they take that money away from you. So for the hospitals, it's a big thing. For us, it was just, managing people that ultimately would end up back in the hospital again. Every time that you have, and we talk about this, to all of our friends and family and, and people that we meet along the way, that, hey, when you have someone in the hospital, have someone there with them, particularly if it's something important, not something where they're just monitoring your COVID. You don't have a pneumonia, and back then you couldn't even go into the hospitals. But anything serious, you should be there for the whole. But people make mistakes all the time, and the doctors and nurses, and we're not infallible. We make mistakes. So it was critical for us to start there, and make sure that these people had a way to be able to transition back home. And if we saw it, and we see it in very small percentages, but we do see it when we arrive that, hey, listen, this was an early discharge, or this patient shouldn't have been discharged yet. There's so many things pending with the patients, but it's all about gathering data points and getting those data points to actionable points.
Yeah, absolutely. And, there's been a lot of across the industry advances with technology, but what excites you the most about the future of technology-driven care management and the potential to really improve those patient outcomes?
Yeah, great question. I hate to answer it like everybody else would, but you're talking about artificial intelligence, but artificial intelligence is rooted in logic, not in having artificial intelligence go out there and scour and do that work for you. No, you need to know what you're looking for. You need to know what you're asking. And if you get those things and you're able to channel the artificial intelligence into this particular space of that particular patient at this particular time, that's where we're talking about innovation. That's where innovation is going to start happening with artificial intelligence. Today, we're building our own, legacy program. We use Inovalon, as part of our, stackable. There's things that you don't want to write. There's things that other people are doing that are better than you are. We had access to Spot, which is access to the mainframe at Medicare. It's the same thing that comes out of Inovalon, but out of Inovalon is so much more useful. We do eligibility checks there. We do preventive medicine. If the patients are qualified Medicare beneficiaries, if they've had their annual wellness, there's a plethora of things that Inovalon puts out there that are touch points that help us make the right decisions for these patients. So technology is something that we've embraced, and we're using our partner Inovalon in a lot of it. Not only in this part here, the beginning where we scour data that's held by Inovalon, but also in the back end when using Inovalon as our billing and revenue cycle manager.
Yes, well, I can certainly speak for all of us on the Inovalon side that leveraging technology and the data is certainly how we're going to help empower customers like you to really help advance healthcare. So. Mario, it has been a pleasure sitting down with you today. Thank you so much for being here and, of course, for your continued partnership.
Justine, it's our pleasure. Thank you so much for allowing us to be here.
Of course. And, of course, to our audience, thank you for watching. Be sure to keep an eye out for our next episode of Innovators.